how are you communicating this? Like the idea of trial, that sets people off too. I don't want to be a guinea pig, right? Like Garo said earlier, I don't want to be a guinea pig. So what other terms can you use? Even thinking about the whole idea of person of color or BIPOC. Some people may not like that term either. So, or saying diverse. Well, diverse is not, that's not a thing. Like these are people, right? So how do you communicate this effectively? That's the biggest thing that we keep hearing, not technology. It's how are you communicating with me? Talk to me as a person. Don't view this as a transactional type of thing. So,
And I think that's where it starts too, Denise, because, look, you and me, Stacy, Dan, like we work in an industry, but if you were to ask any of your friends or family about clinical trials, what's their reaction? Like they're terrified.
Or they
you know,
don't know anything.
or they don't know anything.
Yeah.
What do they know? What they know is what they see on TV, the advertisements.
Yep.
So if you take this drug, you're gonna get A, B, C, D, Z side effects. That's their impression. So
Yeah.
I mean, I think a good approach would be to keep it real, to own that we've messed up throughout history. So when we approach these communities, like rather than being like, a salesman and being like, ooh, come join this clinical trial. Well, like, why don't you begin with being like, look, like, let's keep it real. We do have a reputation. We need to do some damage control here, reputation management, and start off with owning the error and then going into why this clinical trial will be beneficial to you. Because then it breaks down the barrier right away. The minute you mention clinical trial, the minute you mention pharma, like even while working in SGM Alliance, the minute I mention pharmaceutical company, the person I talk to is immediately triggered and they're guarded and they almost don't want to hear anything. So I think that's one method that we should really consider as an industry.